Hi there, my name is Dr. Walt Haddigan. I'm the Director of Clinical Content and Communications at Epocrates. Today we're going to take a look at Epocrates Plus on mobile. So let's walk through a few examples of how E Plus supports clinical decisions starting with diseases. So let's imagine we're in clinic and we need some support managing a patient with suspected COPD. Now here on the reference page of the app, let's tap into the diseases section here in the center of the screen. Typing COPD will then take us to the COPD disease topic with its 5 quick reference sections displayed right up front. A high-level overview of the condition, highlights and basics, is on top, followed by 4 sections arranged in order of workflow during a typical office visit. So firstly, under History and Exam, we'll find a list of risk factors and key diagnostic findings. Tapping into any item, such as cough, shows a brief description of that finding specific for COPD. Next, we see tests. Tapping on any test, for example, spirometry at the top, will show results that support a diagnosis of COPD. Now, before we're ready to jump into treatment, a differential diagnosis section lists other conditions to consider in a patient suspected of having COPD. Tapping into any differential will show a brief description of that condition, for example, asthma here, with a link to its own full disease topic at the bottom. But let's say we're pretty confident in our diagnosis of COPD in this patient, and we're ready to move on to treatment. Under treatment options, we're going to see that patient-centric stratification that I mentioned earlier. Let's tap into Gold Group B, Initial Treatment, to see first and second line treatment options listed for our patient. Tapping at the very top into LABA/LAMA, we'll see various long-acting beta agonist and muscarinic antagonist combos. Tapping on any drug name will take us instantly to the Epocrates drug information for that product, with all of its sections listed, including formulary information always in view right here near the top, allowing informed treatment decisions to optimize drug affordability. Now, before we leave the COPD topic, we can save it for later by tapping the bookmark icon at the top right for even quicker access later.